Hi, my name is Ademaiwa Ademilui. I'm one of the PGY2s at Piedmont Athens Regional. Thank you for joining me today. I'm here to present a very interesting patient. He's a 40-year-old male with past medical history of tophaceous gout, as well as he recently had a Nielsen fundoplication in 2016. He came into the emergency department with complaints of difficulty swallowing that has been going on since his Nielsen fundoplication in 2016. He states that he has to turn his head towards the right side in order to allow food to pass when he's swallowing. He denies any history of odynophagia or any throat pain. Over the last 24 hours prior to presentation, he's had some dysphagia resulting in reduced PO oral intake. But he denies autolgia, dyspnea, no wheezing. He didn't report any headache or facial pain, no night sweats or recent weight loss that he reported. Um, Basically, on physical examination, just from seeing him, he has generalized impressive tophi all over his body, including the digits, the elbow, his abdomen, as well as his knee. Neck examination just revealed tenderness to palpation along the left sternal, the submandibular area. His mucous membranes were moist, no hyperemia or exudates in his buccal examination. Aside from that, his physical examination was unremarkable. No lymphadenopathy was also appreciated. He was later admitted to the ICU as a result of concerns for respiratory compromise, but he remained stable over the course of his ICU stay. Given the fact that all other causes have been ruled out, a CT scan, soft tissue of the neck with IV contrast was obtained, and it showed a moderate to marked enlargement of the left stylohyoid complex with complete calcification, resulting in a mass effect in that area. Given the patient's history of odynophagia as well as dysphagia, Eagle syndrome was diagnosed. Eagle syndrome is defined as an elongation of the stylohyoid process. The incidence is about 4% in the general public, but in this 4%, symptoms is usually attributed to about 0.16% of this population. So here I present to you a patient with the Eagle syndrome. So the main teaching point for this presentation is Eagle syndrome has a variety of symptoms, and there are two different types. We have the cervical facial pain type as well as the vascular type. The cervical facial pain usually is associated with pain on swallowing and pain on neck movement. So this is basically just symptoms is pain. The second type is the vascular Eagle syndrome, which can cause compression of the internal and external carotid arteries. Subsequently, can cause strokes or TIAs, vertigo, and syncope. One of the most common causes of Eagle syndrome is usually found in patients that have had recent dental procedures or tonsillectomy, anything related to the buccal cavity. One of the most common symptom of Eagle syndrome is sensation of a foreign body in the pharynx, dysphagia, odynophagia, as well as headache. So the main reason of presenting this interesting patient is that although rare, Eagle syndrome should always be considered in the differential diagnosis in patients presenting with vague head and neck symptoms. It should also be considered in patients who have neurological symptoms without any objective etiology. Thank you for listening, and everyone stay safe. Thank you.